back to Rappahannock Issues, special edition. We have our debate in the 28th House District. And so we have Dick Heimerstrong, who's going to ask a question to Candy Hilliard.
Mrs. Hilliard, the body cameras for police have been key elements over the past year when there have been some shootings. In as many cases, they've certainly cleared the police of any problems that they may be accused of. There are some people who believe it should be mandatory. If you're in the General Assembly, would you introduce or support legislation that would make body cameras mandatory for all police officers in the Commonwealth?
I absolutely would. I believe that it protects the police officers who have one of the most difficult jobs I can't even imagine. It's not, it's a very tough position that they are in. So it protects them as well. And it also, what I think that they have found with all of the research that's been done in places that have actually instituted the body cameras, it's made a dramatic difference in complaints from the public and also accusations of brutality or of police brutality. So I think it's a win-win all the way around. So
Quick
yes.
follow-up.
Sure.
Should the state provide money to pay for them? Otherwise, it could be considered an unfunded mandate.
I would say yes. I mean, I certainly think it is something that would be very helpful to localities, because I would suggest as well that localities, certainly where the sheriff and police departments are, it's a very tough thing. So any sort of request by the state should certainly be funded. It should certainly be a funded mandate, I guess is the issue.
I'll bet you when Ms. Hilliard was on the Stafford County Board of Supervisors, she used to fuss at us all the time about putting mandates on them, and I would agree with that. I think that our local governments are going to do what's best for their community and what they can do. I like body cameras. I think they're very helpful, and as you pointed out, I think I think law enforcement appreciates them as well. And I think you're seeing more and more of them coming in through the natural process. I don't think that's the kind of thing that the state needs to say, Fredericksburg and Stafford, you're going to do this.
Thank you. Starting with Ms. Hilliard, by the way, I have a cousin who rides around with a camera on the top of his motorcycle helmet. So I'd add that. One of the major issues in the state, and in fact throughout the country, has dealt with mental health. We've seen the ravages of extreme cases of mental health and disease in some of the recent shootings, but most mental health problems fester below the surface, are crises for individual families, and don't result in violence. But they're a major loss to our economy, very damaging to families. And there's a definite issue with regard to access to mental health care, not so much up here, or though perhaps here in this area as well, but in areas throughout the state that aren't as well funded, that are less populated. What do you think should be done to try to improve that situation? Starting with the right to left, Ms. Hilliard?
Sure. One of the things I think we absolutely need to do is we need to expand Medicaid. I mean, there's a huge opportunity there to, they're saying right now $227 million for mental health and substance abuse services. I had the opportunity to speak to some of the folks over at the RACSB, and one of the things that they have certainly said is we are providing services, but it's a real struggle. They're really having a tough time providing the level of care that is needed for our community. We have young people who need mental health care. If we identify folks that have issues with mental health care, we do it when they're teenagers, which is typically a lot of times when that will begin to manifest itself. We are able to provide resources that folks need so that it doesn't become an issue where when they hit 23, 27, that they are folks that, that get into such trouble, get themselves into such trouble, and they're not able to function within our society. Other communities, Kentucky and Ohio, I want to say, have used Medicaid expansion, and what they have found is that it enabled them, they saved enough money that they were able to make major investments in mental health care. And that is something that I feel like we absolutely must do in Virginia. We've not done very well when it comes to addressing the needs of folks who have mental health issues. So that's what I would do. I would absolutely expand Medicaid. I would work to expand Medicaid and bring those resources to Virginia.
Delegate Howell?
I would agree with you completely, David, that mental health is a huge problem that we have in Virginia and across the country, and we're addressing that. There have been several tragedies that have brought it to the forefront. The Virginia Tech situation, Senator Creed-Deeds, recently the situation at the television station in Roanoke. All instances of gun violence, but every one of those perpetrators had legally purchased weapons and had gone through a background check. The problem is the mental health that they hadn't received. And over the past several years, particularly in response to Gus Deeds' incident, we extended some temporary detaining orders and did things like that. We've appropriated more than $175 million over the last 2 budget years in additional funding for mental health clinics, for emergency clinics, for drop-by stations where police or sheriff's deputies can drop someone off and then they can be taken to a facility. So it's clearly a problem, but it's also clearly a problem that we're aware of and that we're addressing.
That ends our questioning time period, so we'll take a short break and come back with closing statements. So come right back after the break.